A presentation of the University of Alabama in Birmingham Dental Television. Dental Anatomy, Maxillary and Mandibular Canines. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright Jr., and Dr. Michael Hughes. Maxillary canine. General characteristics. The maxillary canines are the third teeth from the midline and are identified according to the universal numbering system as teeth number 6 and number 11. The canine contacts the maxillary lateral incisor mesially and the maxillary first premolar distally. In function, form, and arch position, they are intermediary between the incisors and the posterior teeth, and are often called the cornerstones of the mouth. The first evidence of calcification of these teeth is between 4 and 5 months. The enamel layer is completed between the 6th and 7th year, with eruption usually occurring between 11 and 12. Root formation is completed between the 13th and 15th years. Canines are usually the most stable teeth in the dental arch, as they are extremely well anchored. Clinically, they are among the last teeth to be lost as the result of oral disease. The prominent plate of bone overlying the canine root is termed the canine eminence. The labial aspect. The labial surface is convex in all directions, both incisogingivally and mesiodistally, with a general outline that is roughly pentagonal or 5-sided in shape. Mesial outline. Mesially, from the cervical line to the height of contour, the outline can either be slightly convex or possibly concave. From the height of contour, it exhibits a rounded mesio-incisal angle. The height of contour is located most commonly at the junction of the incisal and middle thirds. Incisal outline. The incisal outline is divided into two components by the tip of the cusp. These are the mesio-incisal and disto-incisal slopes or cusp ridges. The mesial slope is normally the shorter of the two. The tip of the cusp usually is located in line with the center of the root. Frequently, the incisal outline varies from this normal configuration due to attritional wear. Distal outline. The distal outline is usually concave from the cervical line to the distal contact area and continues as a rounded incisal angle. The height of contour is in the middle third of the crown. Cervical outline. The cervical outline is evenly curved toward the root. Labial surface. The labial surface exhibits a bold labial ridge incisogingivally, which is a result of the greater development of the middle labial lobe in comparison to the mesial and distal lobes. Two faint developmental depressions on either side of this labial ridge are termed mesiolabial and distolabial developmental depressions. Imbrication lines may normally be exhibited in the cervical third. The height of contour of the labial surface is located in the cervical third. Root outline. The root is conical in shape, convex, and tapers to a sharp or slightly blunted apex. Occasionally, the apex may be seen to curve to the distal. The mesial aspect. The surface of the canine is convex in all dimensions. As with other incisors described, it is triangular in shape. However, it is wider labial-lingually. Labial outline. The labial outline is convex incisocervically with a height of contour in the cervical third. Lingual outline. The lingual outline is concave from the incisal to the cingulum and convex from the cingulum to the cervical line with a height of contour in the cervical third. Incisal outline. The incisal ridge is located slightly labial to the root center and is relatively thick. Cervical outline. The cervical line is evenly curved toward the incisal. Contact area. The contact area is at the junction of the middle and incisal thirds, ovoid in shape, longer incisogingivally. Root outline. The outline tapers from a broad, relatively parallel cervical portion gradually to a sharp or slightly blunted apex. The mesial root surface is convex or slightly flattened. The root is usually wider labial-lingually than mesiodistally. The lingual aspect. The outlines of the lingual aspect are essentially the same as viewed from the labial. The lingual surface is narrower mesiodistally than the labial, due to both mesial and distal surfaces converging toward the lingual. The lingual surface of the maxillary canine presents anatomical elevations in the form of a cingulum, which is unusually large, bulky, and smooth, and marginal ridges which are also bulky and prominent. Normally, a lingual ridge extends incisocervically from the cusp tip to the cingulum in the center of the lingual surface. Located on either side of the lingual ridge are shallow depressions called the mesiolingual and distal lingual fossae. Cervical line. The cervical line curves evenly toward the apex. Root outline. The outline of the root, viewed from the lingual, is the same as that seen from the labial aspect, that is, tapering from the cervical portion of the crown to a pointed or slightly blunted apex. Occasionally, this tooth exhibits a curve in the apical one-third. The deflection, if present, is most commonly to the distal. The distal aspect. The distal surface is similar to the mesial surface, except the distal surface is generally smaller, so that more of the labial and lingual surfaces are generally observed when viewed from this aspect. Cervical line. The cervical line exhibits less curvature incisally than the mesial surface. A slight concavity is usually present in the cervical half of the crown. Contact area. The contact area is more circular than on the mesial and is located more cervically in the middle third. Root outline. The root outline appears to be the same as that observed from the mesial aspect. The incisal aspect. From the incisal, the maxillary canine is generally convex in its outline, exhibiting a diamond shape. wider labial-lingually than mesiodistally. A line drawn labial-lingually through the cusp tip demonstrates the mesial half to be thicker and more convex, while the distal portion is thinner, exhibiting a slightly concave portion to its labial outline. Again, evident from this aspect is the greater development of the middle labial lobe or labial ridge. Mandibular canine. General characteristics. The mandibular canines are the third teeth from the midline and are identified according to the universal numbering system as teeth number 22 and number 27. The canine contacts the mandibular lateral incisor mesially and the mandibular first premolar distally. Because the maxillary and mandibular canines bear a close resemblance to each other, only a direct comparison will be made with the maxillary canine. The first evidence of calcification of these teeth is between 4 and 5 months. The enamel layer is completed between the 6th and 7th year, with eruption usually occurring between years 9 and 10. Root formation is completed between the 12th and 14th years. As in the case of the maxillary canine, the mandibular canine is the most stable tooth in the mandibular dental arch. The labial aspect. The outline of the crown of this tooth, like the maxillary canine, is pentagonal in shape. The labial surface is generally not as convex as the maxillary canine, but more convex than the mandibular incisors. Mesial outline. The mesial outline is roughly straight from the cervical line to the mesial contact. The height of contour is located near the mesio-incisal angle in the incisal third. Incisal outline. The disto-incisal slope is normally longer and more cervically located than the mesial slope. The cusp slopes converge to form a cusp, which is shorter and more rounded than the maxillary canine cusp. The tip of the cusp is located directly over the center of the root, as in the maxillary canine. Distal outline. The distal outline is more convex incisor-cervically than the mesial outline. It is also shorter than the mesial outline. The height of contour is at the junction of the incisal and middle thirds, which is more cervically located than the mesial. Cervical outline. The cervical line has a semicircular curvature apically. Labial surface. The labial surface appears to be longer incisor-cervically than the maxillary canine. This is due to the narrowness of the crown mesiodistally and the comparative location of the contact areas. The labial ridge is not as prominent as in the maxillary canine. The developmental depressions and elevations are positioned and named the same as the maxillary canine. The labial height of contour is located in the cervical third. Root outline. The root of the mandibular canine is the longest in the mandibular arch. The root tapers uniformly to a relatively sharp apex. The mesial outline of the root is nearly straight with the mesial outline of the crown, which is a helpful distinguishing characteristic. The mesial aspect. The crown, viewed from the mesial aspect, presents an outline which is roughly triangular in shape, but noticeably narrower labial-lingually than the maxillary canine. Labial outline. The labial outline is convex, with height of contour located in the cervical third. Incisal outline. The incisal outline is thinner labial-lingually and thus sharper than the maxillary canine. Lingual outline. The lingual outline resembles the maxillary canine, except the incisal edge area is not as thick and the cingulum convexity is less prominent. Cervical outline. The cervical line curves evenly toward the incisal, with the greatest height of curvature directly beneath the incisal edge. Mesial surface. The contour of the mesial surface is basically convex, but with a flattened area just above the cervical line. Contact area. The contact area is located close to the incisal edge in the incisal third. It is ovoid in shape, being longer incisogingivally. Root outline. The root outline is similar to the maxillary canine, that is, tapered to a fairly sharp apex. On the mesial surface, there is a flattened or concave area known as a root concavity, which may extend along the root for its entire length. The lingual aspect. The mesial, distal, and incisal outlines are similar to those of the labial aspect. Cervical outline. The cervical line exhibits a greater cervical curvature than on the labial and is offset with the greatest curvature to the distal. Lingual surface. The lingual surface is smoother and lacking in detail when compared to the maxillary canine. The cingulum and marginal ridges are less prominent. The lingual ridge is also less pronounced, with relatively shallow distal lingual and mesial lingual fossae. Root outline. The outline of the root, viewed from the lingual, is the same as that seen from the labial aspect, that is, tapering uniformly to a relatively sharp apex. The distal aspect. The distal aspect is similar to the mesial in all respects, except that it is slightly smaller in all dimensions. The contact area is located more cervically at the junction of the incisal and middle thirds. It is more circular in shape when compared to the mesial. There is no flattened area just above the cervical line as seen on the mesial surface. The developmental depression on the distal aspect of the root surface is not as pronounced as that on the mesial. The incisal aspect. The most prominent feature is the asymmetrical appearance of the cingulum being offset to the distal. The labial-lingual dimension is greater than the mesiodistal dimension. Anomalies are rare in canines. The crown form does not vary greatly. The root form may vary somewhat, presenting curved roots or occasionally a bifurcated root with labial and lingual segments.